So success is not the destination, friends. You'll have to give some time. Time will never stop, time will never end, but you will have to complete. Finally, वैसे is the not the word here. If you say we can cover a few more topics, ब्रेक लोगे तो और एक्सटेंड हो जाएगा. Let's not take a break. Previous slide is this one. चलो, let's do one more topic. To motivate you, remember this name Bernina. This is considered the most picturesque train journey in the world. So when you get a time, which you will not get for next 10 years, when you get a time, take its ride from Switzerland to Italy or vice versa. You will be able to see all the world beauty in a single train journey, right? But time मिलेगा नहीं, बहुत late मिलेगा. चलो, let's do biomedical waste management. One more topic, then we'll wrap it up. Left, right. ये तो these are easy things. We are poor. Poor नहीं है बोलो, we are from मिडिल क्लास फैमिली. तो सभी मिडिल क्लास फैमिली से हैं भाई. मैं भी मिडिल क्लास फैमिली से ही था. But you will have to give 10 years to your professional career. Then money will keep on coming non-stop, but then you will not be able to enjoy it. So whenever you get time, enjoy best. This is biohazard. This is radiation hazard. Chalo, to motivate you, I am telling you the question of upcoming NEET PG. What is the radius of inner circle in radiation hazard symbol? 1.5 R. Outer circle is 5 R, where R is the radius of black dot in inner circle. So I've told you already the question of upcoming exam, 1.5 R. So when you'll open your paper, many of you will get this as the first question. Right? Okay. We do biomedical waste bags in the opposite direction. Opposite direction. Blue bag. Which waste goes? What is the final disposal mechanism? So blue category, which type of waste goes? Yes, metallic implants and glassware. And what is the final disposal mechanism of blue bag, friends? Autoclave microwave. Final disposal. Final means you have done pre-treatment, you have done treatment. What will happen to blue bag finally? Yes, recycling. There was a question in your paper, pacemaker. So pacemaker is a metallic implant. It will go into blue category. White category. Which type of waste? Final disposal mechanism. If you look carefully, white is a puncture proof container. So it has to have metallic waste sharps, needles. Scalpel, surgical blades, scissors. Final disposal mechanism. Single answer. No, it is not sent for road making. Iron foundry is the single best answer. Otherwise, you are right. We can use sharp spit or landfill also. Landfill also. Red bag. Waste, final disposal mechanism. So which waste goes into red bag in Indian healthcare system? Gloves, rubber, very right. So this is any contaminated recyclable waste. These words you should understand because they also come in choice. So you are right. It is plastic and rubber. Plastic part of syringe, cannula, gloves, catheters, disposal mechanism. Final is road making. So Euro bag goes in red. But if Euro bag contains blood, it will go into yellow. So plastic bag goes into red. If plastic bag contains red, it will go into yellow. Right? Gloves with blood will go into red after local disinfection. After local disinfection. A question was asked in your paper on vacuum-tainers. Which bag it goes? Again red. Whatever is left, yellow. So can you tell me waste which go in yellow actually? Yes, human anatomical waste, amputated fingers, limb, appendix, gallbladder, placenta, animal waste, then soiled waste. What is soiled waste? Because a question came on this in your paper recently. What is soiled waste? Any cotton or cloth material. So question asked in your paper was swab. After inoculating a culture plate from a nasopharyngeal swab, the cotton swab will be thrown into yellow category. So any cotton or cloth material. So swab, bandages, dressings. Then what else goes here is chemical waste, cytotoxic, anti-cancer drugs, discarded medicines. Discarded medicines mean expired medication. Then liquid waste after disinfection and any other similar activity. Then microbiological and biotechnological waste. What is included in this category? Culture plates, sera, toxins, and never forget live vaccines also. Live vaccines also. Then bed linen mattresses. Now, if you look liquid waste, logically, after chemical treatment, it should be thrown into drain. So this is different. But when we look at all other, what is their common final disposal mechanism? Yellow bag should be only live vaccines. Only live vaccines. Killed are not dangerous. You can mix with a chemical, throw it in the drain. Yes, the major disposal mechanism is incineration. Quickly tell me temperature of incinerator, autoclaving, hydroclaving. Temperature. Incineration is 1200. Autoclaving, you study in micro also. 121 is the commonest temperature we use in India, very right. Otherwise, 135, 149 also. Hydroclaving commonest at 132. Incineration principle, high temperature dry oxidation. Autoclaving, we'll come to that. We'll come to that, Dr. Viral. Autoclaving, hydroclaving, it is steam under pressure. Can you tell me how much pressure is inside the autoclave? Microbio and PSM question both. Yes, 15 psi. How long it is carried out? 45 minutes. Autoclaving. How do you check sufficiency of autoclaving in India? Geobacillus styrothermophilus. Hydroclaving Bacillus subtilis. Contraindication is radioactive waste, reactive chemical waste, pressurized waste, heavy metal waste. Okay, red bag also should never be. And PVC plastic waste. PVC waste will lead to which cancer? Polyvinyl chloride plastic, angiosarcoma of liver. Good. When we convert large volume of toxic biomedical waste to non-toxic, what is the method? Which chemicals are used? NEET PG question. Very right. This is known as inertization. So please be careful, it's not incineration. We are making the material inert. What is the inertizing material used in India? Yes, along with concentration was asked 15% cement, 15% lime. Inertization NEET PG. This method is known as, INI-CET asked this method in detail. What is this method known as? Biomedical waste. Very right, Dr. Goku is correct. Screw fit technology. We have non-burn dry thermal process. Now what do we do? We take biomedical waste, mix with cement or another neutralizing substance like lime, put it in a big rotating drum like we have on construction site, these trucks with white rotating drums, and we start giving heat from below. So we start heating this drum, but we don't burn it. So it starts churning, and constantly it keeps on rotating. The auger keeps on rotating and it compacts the weight. So it reduces weight by 20 to 25%, volume by 80%. It is used for all types of infectious waste, including sharps. It is strictly contraindicated for radiological waste, cytological waste, and pathological waste. When question came in INI-CET, all these points were given in different choices. So it's not again maximum. This is the minimum maximum we have to remember from screw fit technology for biomedical waste. So radio, patho, and cytological waste, it should never ever be used. Mercury spill. How will you proceed further? Next step. What should I write? Yes, collect using cardboard. Don't touch by hand or gloves. And what do you do to the drops? उन ड्रॉप्स का क्या करेंगे? Yes, it is put in water. So it may be a plastic cup or a container. Close it, label it properly. If cardboard is not there in hospital setting, plastic syringe, take off the needle and you can take. Mercury, what is the final disposal mechanism? Recycling. So final disposal mechanism is recycle. Blood spill. What do we use? Hypochlorite. How much? 1% for small blood spill, 10% for large blood spill. TB sputum, Indian program, what is the guideline? Best method of disinfection. Autoclaving can be done, but best method is incineration. If incineration is not possible, go for dry burning at home. Multiple response answer if they ask in INI-CET. 10, 5% cresol, autoclaving, and even boiling can be used. Right? And finally, this e-waste. What is the disposal mechanism? It is recycling. See, why else